You can have a body covered in tiny skin growths and still get blood tests that come back normal. Yet your immune system might be sending you a loud warning right through your skin. Most of these bumps are not skin cancer, but they are often tied to human papillomavirus, or HPV, one of the most common infections on the planet. And the gap between I handle this at home with simple, cheap tools and I end up in a surgeon's chair often comes down to what you do in the first few weeks after spotting that first tiny stalk on your neck. If you want health science explained in plain language, subscribe and hit like. The goal here on Dr. Waterling is to reach 300,000 subscribers, and you help that happen every time you tap that button. If you like having practical checklists, scan the QR code on screen while you watch. That takes you to my Telegram channel where I post step-by-step health guides. Let's start with the basics. What is actually growing on your skin, what it tells you about your immune system, and what you can reasonably discuss with your doctor about diet, movement, and safe at-home care. You will hear some very direct advice in this video, but I am not your doctor and I am not a practicing physician. Use this as a clear roadmap for questions, not as a personal prescription. Now, let's sort out what those bumps really are. Most people lump every little bump under one word, wart. In reality, your skin can grow several completely different things, and you absolutely should not treat them all the same way. One group is soft, flesh-colored, dangling growths sitting on a thin little neck of tissue. These are classic papillomas or skin tags, and they are usually linked to HPV living in the top layers of your skin. HPV is a huge family of viruses. Some types live mostly on the genitals and can drive precancerous changes and cancer, while other types prefer the hands, feet, or ordinary skin and cause benign growths. Another group is the true wart. Firm, rough, almost stone-like, often on fingers or the sole of the foot, sometimes with tiny dark dots inside. Those dots are tiny clotted blood vessels feeding the wart. These are also driven by HPV, but usually by different subtypes than the ones behind genital warts or high-risk precancerous changes. Then you have the stuck-on age spots called seborrheic keratoses. They look like someone pressed a waxy brown flake onto your skin. Flatter, wider, often darker, and they tend to show up as you get older and after years of sun exposure. These are not caused by a virus. They are age-related growths tied to how skin cells renew themselves over time and to chronic ultraviolet light exposure. And there are moles, especially the hanging, darker ones that people confuse with papillomas. These usually carry more pigment, sit on a thicker base, and they belong strictly in the do not mess with this at home category. Any mole, especially if it is dark, irregular, or changing, needs a dermatologist, not a home recipe or a pharmacy acid. This is a key point. If you do not know what kind of growth you are dealing with, you can easily pick the wrong treatment and turn a small cosmetic issue into a bigger medical problem. Dermatologists use a simple 3-step rule to decide what deserves a closer look, and you can borrow the same logic at home in front of a mirror. First, color. A harmless skin tag or age spot usually keeps one even tone, light beige, light brown, or close to your own skin color. If one growth shows several colors, light, dark, almost black, maybe some red, that is a reason to book a skin check, not to start burning it with acid. Second, the border. Run a finger along the edge. If the border feels smooth and clear, that is more reassuring. If the edge feels ragged, blurred, or as if the pigment spills into the nearby skin, that growth deserves professional eyes. Third, growth over time. Think back 6 months. If the bump looks the same in size and shape, the risk is lower. If it has clearly grown, changed shape, or started to stick out more, get it checked. A dermatologist can often tell you in under a minute what they are looking at, especially with a dermatoscope, a small magnifying device that reveals the internal pattern of the lesion. That one quick visit can save you weeks of guessing and avoid treating a dangerous mole like a harmless wart. Now the big question, why do you even start growing these things in the first place? HPV is everywhere. Health agencies estimate that almost everyone who is sexually active will encounter HPV at some point. And huge numbers of people carry HPV types that cause warts or other growths at any given time. Most infections never cause visible problems because your immune system quietly keeps the virus under control, and many infections clear on their own. So if HPV is so widespread, why does one person at 50 have smooth skin and another has dozens of little stalks on the neck, under the arms, and around skin folds? The difference usually is not you caught a rare virus yesterday. It is your internal defenses lost some ground and the virus you already had got bolder. Three systems matter a lot here: your micronutrient status, especially zinc, your gut and the immune tissue around it, and your stress and hormone balance. Let's start with zinc. Zinc is a trace mineral that immune cells use for growth, signaling, and repair. When zinc is low, T cells and natural killer cells do not fire at full power, and your body handles viral infections less efficiently. As you age, your gut often absorbs zinc less effectively, and diets heavy in refined foods but light in seeds, nuts, seafood, and quality meat make that worse. Clinical studies show that zinc deficiency is common in older adults and is linked with more frequent infections and weaker vaccine responses. So when you see more papillomas showing up after 50, part of that pattern can reflect years of low zinc intake combined with age-related absorption changes. Next, your gut. Immunology research is very clear on this. The intestine holds an enormous share of your immune cells and is one of the busiest immune organs in your body. When experts say around 70% of the immune system is in the gut, they are simplifying, but the core idea is solid. Mucosal tissues in and around the gut are a major base for immune activity. If your gut lining is inflamed and your microbiome is out of balance, your defenses against viruses are not running at full strength. High sugar intake, lots of white flour products, and long-term use of acid-suppressing drugs all shift the gut environment in ways that can disturb the normal bacteria supporting healthy immunity. Then there is chronic stress. When you live in a state of long-term worry, poor sleep, and constant tension, your body pumps out more cortisol, the main stress hormone. Short bursts of cortisol help you handle danger, but constant elevation can weaken T cells and natural killer cells, the very cells you rely on to keep viruses, including HPV, under control. Research on stress and immunity repeatedly shows that people under chronic psychological stress mount weaker antiviral responses and have a harder time keeping latent viruses quiet. That matches what many people notice: a wave of new papillomas during or after a divorce, job loss, illness in the family, or a long stretch of bad sleep. There is a pattern in clinical practice that makes this concrete. A common story in dermatology notes goes like this. Linda, in her late 50s, has a few tiny skin tags on her neck for years. Then her husband gets seriously ill, she sleeps badly for months, loses weight, lives on toast and coffee, and over the next year, her neck and underarms fill with dozens of new soft growths. Nothing changed about the virus, but a lot changed about her immune system and stress load. So if you want to calm down what you see on your skin, you can not only attack the bump. You also have to support the systems that keep HPV under control: nutrition, gut health, stress, and circulation. Let's talk food first, because this is one area where you can usually start changes quickly, always keeping your own conditions and your doctor's advice in mind. Pumpkin seeds are one of the simplest, cheapest zinc sources you can add. A small handful of raw, unsalted pumpkin seeds a day can cover a solid portion of the daily zinc target for many adults. For you, that means your immune cells get a steady supply of a mineral they literally need to do their job, especially as absorption tends to drop with age. Fermented foods like sauerkraut can help your gut bacteria. Naturally fermented cabbage, not vinegar pickled, carries live lactic acid bacteria that support a healthier microbiome. Health bodies include fermented foods as part of generally healthy dietary patterns because they boost the diversity of gut microbes, and that diversity supports better immune regulation. Garlic is another tool. When you crush or finely chop garlic and let it sit for several minutes, it forms allicin, a compound with antimicrobial and antiviral activity in lab studies and some human research. If you swallow garlic right after cutting it, less allicin forms, so waiting those minutes before eating can make a real difference. At breakfast, swapping instant flavored oatmeal for real rolled oats that you cook, then adding a spoon of ground flaxseed gives you both soluble and insoluble fiber. That fiber works as a prebiotic, food for your beneficial bacteria. And they respond by producing short-chain fatty acids that strengthen the gut barrier and help regulate immune responses. At lunch, adding several spoonfuls of sauerkraut plus cooked beet with a spoon of unrefined oil gives you fiber, plant compounds, and healthy fats that support the gut and liver. Over weeks, many people notice easier bowel movements, less bloating, and more stable energy when they consistently shift away from white bread, sweets, and ultra-processed food toward fiber-rich whole foods. In the evening, that handful of pumpkin seeds plus your prepared garlic dose closes the loop. Zinc, fiber, sulfur compounds, and plant nutrients, all quietly working in the background while you sleep. Alongside what you add, you also look at what you pull back. Cutting down on added sugar and white flour reduces fuel for less helpful gut microbes and yeast, which can otherwise overgrow and tip the microbiome out of balance. If you take acid-suppressing medication like proton pump inhibitors for a long time, there is evidence they alter stomach acidity and can shift the gut microbiota. This is worth reviewing with your doctor if you have been on them for months. A very simple morning habit many people find helpful is warm water with a small amount of natural apple cider vinegar before breakfast. Because vinegar can irritate the stomach lining, especially if you have reflux, ulcers, or high acidity, you should only consider this after talking with your doctor, and you can always just use warm water if vinegar is not safe for you. Now, stress. You are not going to breathe away a virus, but you can absolutely use your breath to push your nervous system out of constant fight or flight and into a calmer state where your immune system works better. One of the simplest tools is diaphragmatic breathing with a longer exhale. Here's how it looks, described in plain terms so you can practice and then discuss it with your clinician if you like the idea. You sit or lie comfortably. One hand on your chest, one hand on your belly. You breathe in through your nose while counting slowly to 4, letting your belly rise more than your chest. You pause with full lungs for about a 4 count, then breathe out through your mouth for about 6 counts, letting the exhale be noticeably longer than the inhale. This pattern, longer exhale, belly movement, stimulates the vagus nerve and the parasympathetic nervous system, the part that runs rest and digest functions. Studies and clinical experience show that slow breathing like this can lower heart rate, reduce perceived stress, and improve sleep in many people, especially when you practice a few minutes each morning and evening. A reasonable target to discuss with your provider is 5 cycles in the morning and 5 at night. That is only a few minutes, but done daily for a couple of weeks, many people feel calmer and sleep deeper. While you work on the nervous system from the inside, you also help your circulation from the outside, especially your lymphatic system. Unlike blood, which has the heart as a pump, lymph fluid depends heavily on muscle movement and body motion to flow. When you sit for many hours every day, lymph flow slows down. Waste products and immune debris linger in tissues longer, and local immunity in the skin may not run as efficiently. A very simple whole body movement for lymph is standing trunk rotations. You stand with your feet about shoulder width apart, arms hanging free, and gently twist your torso side to side so your relaxed arms swing and tap your ribs, belly, and back. You do not force the motion, you do not snap the joints. You simply let the body gently twist and untwist, maybe for 3 minutes in the morning and 3 in the evening at a comfortable pace. These rotations repeatedly squeeze and release the soft tissues around your lymph vessels and abdominal organs, which helps move lymph and blood and can reduce that puffy feeling many people notice in the face and hands when circulation is sluggish. Some people like to combine that with quick acupressure points. One popular point sits in the web between your thumb and index finger. Another is in a small hollow just below the most prominent bone at the base of your neck. Acupressure comes from traditional medicine, and while the mechanism is not fully understood and evidence is not as strong as for some other treatments, small studies and a lot of lived experience suggest it can ease perceived tension and stress for some people. If you choose to try this, you press each point mildly firmly for about half a minute, a few times on each side, right after your rotation exercise. And you stop if it hurts or feels wrong, especially around the neck. Now we get to the part most people are really impatient about: what you can put directly on these growths, and more importantly, what you should never do to them. Dermatology clinics see the same self-inflicted mistakes again and again. Knowing these can literally save you from weeks of pain and from scars. First, strong plant saps and homemade burning recipes. Celandine sap is a classic folk remedy in some countries, but in raw form, it is a strong alkali that burns everything, not just the wart. People dab it on, hoping for a quick fix, and end up with chemical burns around the growth, infections, and sometimes scars bigger than the original bump. Second, tying off growths with thread or hair. The idea is to cut off blood supply so the papilloma dries up and falls off. If you do not catch the entire base, you injure the tissue, trigger inflammation, and can still leave virus-infected cells behind, setting yourself up for a swollen, painful area that may need surgical attention. Third, cutting growths with manicure scissors or razor blades. You may remove the visible bump for a moment, but you also slice tiny blood vessels, cause bleeding, open a door for bacteria, and leave HPV positive cells in the skin ready to regrow. Doctors regularly have to clean up infected, bleeding wounds after people snipped off something that could have been handled cleanly in clinic. Fourth, using strong vinegar essence on the skin. Concentrated vinegar can cause deep chemical burns and scars, especially on the neck, chest, and body folds. Yes, the growth may die, but so does a lot of healthy skin around it, leaving a mark that lasts far longer than the original bump. Fifth, tearing papillomas accidentally with jewelry or collars and then ignoring the injury. When a stalk gets ripped, virus-containing cells can smear onto nearby skin. That auto-inoculation is exactly why you sometimes see a cluster of new growths around one that was torn off by accident. And finally, using one treatment on the wrong kind of growth. Salicylic acid, for example, works best on thick, hard warts, not on soft, thin skin tags. Castor oil, on the other hand, is gentle and better suited for softer lesions, but it will barely touch a deep plantar wart sitting under a thick callus. So what are the main topical options people discuss with their doctors for benign lesions that have already passed that basic color, border, growth check and have been confirmed as non-cancerous? One of the gentlest is plain castor oil. Castor oil is rich in ricinoleic acid, which has anti-inflammatory and softening effects on thickened skin. When you massage a small drop into a soft papilloma and cover it, over time the tissue can soften and sometimes shrink, especially with small, recent growths. A common routine people discuss is dabbing castor oil directly onto the lesion twice a day and covering it with a small bandage to keep the area moist. Results are slow and not guaranteed. It may take 1 to 2 weeks before you see any change, and some people see no response at all, but the method is gentle and inexpensive. Then there are antiviral or immune modulating creams. In some countries, people use an antiviral ointment called oxalin as part of home care for virus-related skin growths, although solid modern trial data are limited. In the United States, the closer idea would be prescription creams that help the immune system attack virus-affected skin, such as imiquimod, which doctors mainly use for certain warts and precancerous lesions rather than simple skin tags. The reference protocol you saw blends a stronger antiviral ointment with petroleum jelly, then applies the mix under a bandage to keep the active ingredient on the bump longer. The petroleum jelly creates an occlusive layer, a greasy film that holds moisture and medication against the skin so it can penetrate deeper, an approach dermatologists also use with steroid creams to boost their effect. If you want to explore something similar, the safe path is to ask your dermatologist whether an antiviral or immune modulating cream plus an occlusive dressing makes sense for your particular lesions, and if so, which product and schedule fits your skin and medical history. You should never invent your own mix for eyelids, genital areas, or inflamed skin, because those zones are far more sensitive and riskier to treat without supervision. Now, salicylic acid. This is the workhorse for common warts on hands and feet in many clinical guidelines. Salicylic acid is a keratolytic, meaning it dissolves the outer layers of thickened skin and also slightly irritates the wart so your immune system finally notices it. Guidelines from groups like the British Association of Dermatologists list salicylic acid as a first-line, evidence-based treatment for many non-genital warts, including plantar warts, with cure rates in well-run studies that clearly beat placebo when people use it correctly for long enough. The key phrase there is correctly for long enough. Think in terms of weeks to months, not days. A typical protocol looks like this, and you can use it as a checklist to review with your doctor or pharmacist. You soak the wart area in warm water for several minutes to soften the thick skin. You gently file the dead, white surface off the wart with a disposable emery board or pumice stone, being careful to stop if you see pinpoint bleeding. Then you apply the salicylic acid product directly to the wart, protecting the surrounding healthy skin with petroleum jelly or a thick cream, and cover the area with a bandage or wart pad to keep the acid in place. You repeat this daily, or as the product instructions say, often for many weeks. 3 months or longer is common before doctors call it a failure. During treatment, the wart usually turns white, softens, and peels layer by layer. You trim what is already dead and loose after soaking, and you never cut into living tissue. People with diabetes, significant circulation issues, or immune problems should not treat warts this way on their own feet and hands because of the risk of ulcer and infection. They need a tailored plan from their doctor. For very stubborn plantar warts on the soles, one more intense option the reference describes is an overnight salicylic acid compress using plastic wrap to boost penetration. Again, this is something to only consider with explicit medical guidance because stronger acids under occlusion can easily overshoot and cause burns, especially if you fall asleep and leave them on longer than planned. Whatever regimen you try with your clinician's blessing, there are clear red flags. If a growth starts bleeding, ulcerating, or changing color after treatment, you stop everything and get it checked instead of doubling down. Now, let's talk about the full system the reference builds. Daily breathing, food, movement, and a topical routine, because when you put these pieces together, you start to see why people often report broader benefits beyond just fewer bumps on the skin. A day on that kind of plan might look like this, and you can use it as a blueprint to customize with your healthcare provider. You wake up, stay in bed for a few minutes, and do 5 cycles of the slow belly breathing we talked about. In for about 4 counts, pause, out for about 6 counts. You get up and drink a glass of warm water, with or without a teaspoon of natural apple cider vinegar, depending on what your doctor says about your stomach. Breakfast is cooked oats with a spoon of ground flaxseed and a small handful of raw pumpkin seeds, giving you fiber, zinc, and healthy fats. After breakfast, you spend about 3 minutes doing gentle trunk rotations, then a few rounds of acupressure on the hand and neck points if they feel comfortable for you. Sometime during the morning, you apply your agreed upon topical, castor oil or an antiviral cream or a salicylic product, depending on the lesion type, directly to the growth, then cover it with an appropriate bandage or dressing. Lunch is whatever fits your culture and health needs, plus a few spoonfuls of sauerkraut and some cooked beet with a spoon of unrefined oil. In the evening, you prepare a small crushed garlic clove, let it sit those minutes so allicin forms, then eat it with food if your digestion allows, and you have another handful of pumpkin seeds. Before bed, you repeat your breathing practice and a shorter round of trunk rotations. Maybe refit any topical dressing if your regimen calls for night application. Then you sleep, which may actually improve thanks to the breath work and lower stress load, further supporting immune balance. None of this is magic. It is just stacking small, evidence-based changes that support the systems your body already uses to keep viruses quiet and skin renewal healthy. At some point in this video, you probably thought, okay, but what if I just want them gone quickly? That is where clinical procedures come in. If you have many growths, large ones, anything on the face, eyelids, or genital area, or if the home level plan does nothing after several weeks, dermatologic procedures are the logical next step. Doctors use tools like cryotherapy with liquid nitrogen, electrosurgery, or lasers to destroy the lesion in a controlled way, often in a single visit. These methods carry their own risks, like pigment changes and small scars, but they are predictable and supervised, which is a lot safer than random acids and blades in your bathroom. For many people, the most powerful approach is a combination: clinic removal for existing lesions, plus lifestyle and immune support so new ones show up less often. There is one more habit that does not cost much but can save you a lot of uncertainty: a yearly skin check. Checking your growths with a dermatologist once a year, or more often if you are high risk, gives you peace of mind and a chance to catch trouble early. Now let me ask you something that actually matters here. After about 50, HPV seems to take more advantage of the natural dip in immunity. More people in their 50s and 60s start to see clusters of papillomas and other benign growths compared with their 30s. How old are you, and do you feel like your skin has changed in the last few years? Your age shifts both your risk profile and which strategies make the most sense, so share it in the comments if you are comfortable. So what do you do with all of this? First, you stop treating every bump as just age or just a wart. You respect your skin as an organ that mirrors what is happening inside. If a growth looks suspicious by color, border, or change, you put home treatments on pause and let a dermatologist call the shot. Second, you talk with your doctor about building a simple, sustainable routine that supports your immune system. More zinc-rich and fermented foods, more fiber, less sugar and white flour, and fewer unnecessary acid-suppressing drugs. You add a stress-calming practice you can tolerate, like the slow breathing we walked through, and some daily movement to help lymph and blood flow, even if it is only a few minutes of gentle twisting. Third, you pick one clear, appropriate topical strategy with professional input. Gentle oils for soft tags, salicylic acid for true warts, or a prescribed cream if that fits your case. And you give it time instead of jumping between 10 different home recipes. If several weeks go by with no change or things get worse, you do not blame yourself or the wrong herb. You simply escalate to a dermatologist for procedural options. And finally, you treat every new cluster of growths not as a cosmetic emergency, but as a little nudge from your immune system to check in on sleep, stress, gut health, and long-term screening, including HPV vaccination and cancer screening where it applies to you and your age group. Everything I have told you today is here to help you understand your body better. It is education, not a personal treatment plan, so always run it past a clinician who knows your full health picture before you change anything important. If this gave you a clearer way to think about your skin and your immune system, subscribe and tap like. That is how Dr. Waterling keeps growing toward that 300,000 subscriber mark. For practical checklists and short health posts that walk you through these routines step by step, scan the QR code on screen now to hop into my Telegram channel.